So today we're going to have Miss Amy Bosman talk to you about a career in nursing. So Amy Bosman is currently a registered nurse at Baptist Medical Center in Jacksonville, Florida. Amy also graduated from the University of North Florida in 2022, and she currently works for the Labor and Delivery Unit at Baptist Medical Center. So I'll leave it off to Amy. Amy, you can say whether maybe you want questions in like throughout your presentation or at the end, maybe whatever you prefer.
Sure, maybe we can just do questions at the end. Alrighty, well, I'll go ahead and get started. Thank you for that, Cam. Again, my name's Amy, and it's nice to speak with you guys tonight for having me. I made this little PowerPoint for you guys. It's not a lot, but it's just going to keep me on track. So I'll go ahead and get started. Will it work? There we go. So I just wanted to kind of share a little bit about myself before I start talking to you guys about nursing. I wanted to make this as broad as I possibly could because there's just so many opportunities within the field of nursing itself. So I just kind of wanted to tell you guys a little bit about myself and my career path. So I've been a registered nurse since July of last year. I received my BSN degree from the University of North Florida, swoop, and I was born and raised in Jacksonville. So it was a perfect transition going to UNF. I didn't have to move away. And that was just kind of my preference. I wanted to be close to home, to family. The hospital that I specifically work at is a LDRP unit, which means that we have labor, delivery, recovery, and postpartum all in one unit, which is really nice. So I'm trained on labor and postpartum. So some days I'm doing labor, some days I'm doing nursery, some days I'm doing postpartum. It really just depends on the day. But specifically at my hospital, we're super, super busy. We average about 3,500 to 4,000 babies a year, which is a lot. So that's typically about 15 to 20 births a day. So it keeps me on my toes, and I definitely get all my steps in one day. But other than that, another just kind of like fun fact about me, I know a lot of people want to get their minors with like a major degree at a university. So I got a minor in American Sign Language interpretation. That's something that's very close to my heart. I took ASL classes in high school, and I'm just super passionate about providing that opportunity and bridging the gap of language between our patients that are deaf and hearing nurses and doctors. So that's something I'm super passionate about. So if you guys have any questions about that, at the end, I'll be glad to answer that. But it's super helpful having that degree because in Jacksonville, we're super close to the Florida School for the Deaf and Blind. So I get to use it every now and then. So hopefully in the future, I can get my medical interpreting license to kind of help those individual patients. But on this slide, I put a couple pictures of me. In the bottom right corner is me and my preceptor. That was one of the older nurses that trained me and taught me all her ways. She's been a nurse for over 30 years. So hearing all of her knowledge and her little nuggets of information was just amazing. In the top right corner was a couple girls that I went to nursing school with, actually. So it's super cool that now we're nurses together and we get to work together. So I think that's really cool. So I did want to preface before I went over this slide with you guys. So I kind of wanted to give you guys like a general summary of like how I became a nurse, and kind of the steps that I took in my life to becoming a nurse. To preface, it's different for everybody. I know a lot of people can't afford to go and get a bachelor's degree at a university, and getting an associate's degree at a community college may be the best route for you in regards to becoming a nurse. So I just wanted to preface to everybody, this was just kind of my game plan, and then how I became a nurse from the time I graduated high school to the time of right now. So I graduated in May of 2018, and I went directly, I took the summer off. I wanted to enjoy myself. I was very blessed to get an admission straight into the fall semester at UNF. So I didn't have to do summer classes. But that, again, that's going to be different for everybody. So I just took the summer off. I worked, earned some money, because life of a college student is hard and you need to save your money where you can. So I worked full-time as a daycare teacher, and then I started my classes in the fall at UNF. And then I kind of worked my way through my prerequisites. At every university, they're going to require you to take the very basic science classes that a nurse would need. So your biology, your chemistry, your microbiology, as well as your anatomy 1 and 2. So those are kind of the classes that you have to think about that you'll need to take into getting into becoming a nurse. So I worked my way through those classes. I learned the difference between high school and college life. In high school, you've got people telling you, hey, you need to go to class. You've got a very structured lifestyle, whereas in college, there's not really many people there to guide you. So you're kind of on your own in that sense. You're adulting per se. So you really got to show up to your classes and make an effort to learn those things because you definitely use them in your career. So I went through those classes, struggled because it was hard, but that's kind of the degree. And then in January of 2020, I started my clinicals in nursing school. So when you go to nursing school, you do your didactic classes, and then you also do your classes where you're just learning the basic fundamental things, so understanding the anatomy and the physiology of the human body before you're actually going to clinicals and you're using that information and you're applying it to being a nurse. So I thought that was super awesome that in nursing school we had the opportunity to do that and shadow at many of the hospitals around here. I thought that was really, really cool. I made some great connections. But obviously, as you can tell by the timeline, that was at the start of COVID. So I missed a lot of my clinicals, but that's okay. And so in December of 2020, I started a job as a CNA while I was in nursing school. I felt like that was very helpful in the aspect of learning how to talk to patients and how to work at the bedside with different people of the interdisciplinary team, doctors, physicians, PTs, OTs, social work. I got to be a part of those teams, and I thought it was really, really good job to kind of get my foot in the door as a nurse. And then in May, so this past May, I graduated with my BSN from the University of North Florida. A long time coming. It was a 4-year degree. So I got my bachelor's. So I got that out of the way. And then in regards to becoming a nurse, every nurse has to sit for a licensing exam to get their license. So just because I got a bachelor's in nursing did not mean I was an actual nurse, because a lot of people can go through college and get a bachelor's and they don't know how to sit for a board exam. So that's a requirement by the National Licensing Board to make sure I'm, one, a safe practicing nurse, and two, I understand how to work as a nurse. So whether you become an LPN or an RN, I'll kind of dive into a little bit later, but everybody has to sit for a licensing exam. So I studied my butt off for that because I was not trying to retake it, and it costs money to take your. So I was like, I don't want to pay more money. So I studied for a really long time, and I sat down for my board exam and I passed it on the first time, thankfully. So that's kind of like the pathway that I took. Again, it's going to be different for everybody, but that was kind of my career path. So then I took about a month off, and then I started my job as a labor delivery nurse in August. So that's kind of how I started. So I wanted to kind of go over that with you guys before I start about like nursing and the different avenues of being a nurse. So you're probably wondering, what the heck does a labor and delivery nurse do? So I kind of wanted to give you guys just like the bare minimum, like the meat and potatoes of what it's like on a day-to-day basis for me as a labor and delivery nurse. The beauty of labor and delivery is you're dealing with adults and you're also dealing with pediatrics. So I get the best of both worlds. I'm dealing with the mom and I'm also dealing with the baby. So that's the beauty of being a labor and delivery nurse. Some of the things that I do on a day-to-day basis, I'm obviously celebrating birthday parties every day at work. I think that's a really cool thing, being able to be there for someone on their actual birthday. So that's kind of one of the main roles for my job. And it's to what I do to help a laboring mom. A lot of it is communication between the actual patient and the physician. A lot of that is facilitating emotional support as well as pathophysiology support of the mother as she's laboring. And then also monitoring the status of the mom and the baby. How is the baby tolerating labor? Can I do different positions positions with the mom, helping answer questions that she may not understand that I do on a daily basis that she doesn't every day. So that's kind of some of the main roles that I have. Um, Another thing that I'm trained in labor and delivery is preparing for emergencies. So any part of nursing, you're going to deal with emergencies. You're in a hospital where people are sick. I think this sounds bad. My favorite part of the job. Obviously, we don't want people to be hurt, and at the end of the day, we don't want people to have bad outcomes. But that's what keeps you on your toes as a nurse. It's never a boring day. So that's what I love about the job. Is one day I could be showing up to work and it's a perfect labor, perfect delivery, and then one day it's not. So keeps my wheels turning at work. I am constantly learning every day. In the medical field, you're learning something every day. Another thing that I do on a daily basis at work is education. So, a big part of a nurse and our roles within the healthcare system is educating our patients in regards to the labor process, breastfeeding, postpartum, newborn maternal relationship, all questions. So, whether you work in labor and delivery or you work in pediatrics, ICU, ER, a main job of a nurse is going to be education. Because a lot of times physicians come in the room and they only have a set amount of time they can spend with that patient. And so they come in, they explain things, and then they leave. And then it's kind of like, whoa, I didn't understand anything they said. So the main job as a nurse is interpreting what the physician said and putting it in terms that the patient can understand. Are labor and delivery nurses the same as a pediatrician? No. So pediatricians are actual physician nurses or nurses. Those are two completely different pathways. But labor and delivery nurses, as a labor and delivery nurse, you're dealing with adults and pediatrics, whereas pediatrics, you're just dealing with the kiddos. And I'm dealing with mom as well. But that's a good question. And then lastly, one of my other main roles is doing medical assessments, medication administration, and anything else that is thrown my way. So the main role of a nurse as well is medication administration. So my main job is making sure I'm understanding why this patient is receiving they're getting, they're prescribed, and then also giving it to them in a safe, and also educating them as to why they're receiving that medication. I'm also lastly in charge of communicating between all the different people within the interdisciplinary team. So I'm communicating between the doctor, between the CNAs, between environmental services. So it's never boring, that's for sure. So I kind of wanted to talk about with you guys kind of the benefits of what being a nurse is. So I feel like a lot of times people are like, oh, nurses just, they just listen to what the doctor does all day and that's what they do. Or labor and delivery nurses just cut babies all day. And that's not what we do as just nurses, right? We're not just nurses. Nurses are a big part of the healthcare system, and the actual healthcare system itself would not function without nurses. So a lot of the benefits of being a nurse revolve around flexibility and job security, but there's a lot of different perks too of being a nurse. So, kind of the first thing is flexibility. So, many nurses, like myself, who work in a hospital, work 3 days a week, which is great because we have 4 days off the rest of the week. So, I typically work 3 12-hour shifts. So, the past 3 days, I work 3 12 hours. And then I have 4 days off, which is really, really nice. So you can kind of do whatever you want the rest of the days of the week. You can also work from home as a nurse, depending on what you do. You can also work Monday through Friday if that's something you want to do as well. So that's the benefits of nursing as a career as a whole. Lifelong learning opportunities. So the big thing about medicine is it's constantly evolving. You're constantly getting new studies out. You're constantly getting new results and new breakthroughs in medicine that were never discovered before. When you're showing up to work, it's not like the same old thing over and over again. It's like, wow, that was not there before, or wow, this wasn't discovered until yesterday. I want to learn more about that. And so that's the beauty of nursing is you're showing up to work and you're like, wow, I get to use my brain every day because it's something. Another big thing about nursing is job security. So even though we are a constant revolving society using technology, nurses are never going to be replaced by robots or anything like that, or technology advances in the future. So The hospital system is always going to need nurses, and that's the beauty of the career is once you become a nurse, you can do anything and you will be good at a job. And I will also say that after graduation, almost my whole entire class had a job lined up before they graduated. So that's another beauty of nursing is people are literally jumping at the bits, be like, hey, I want this nurse, I want this person. And that's the beauty of the career. A sense of fulfillment. So that's a huge part of being a nurse is you're making a difference every day you show up to work and you're making change in your workplace. You're dealing with people on some of the best days and the worst days of their lives. And I think that's just beautiful and a privilege that you get to be there for those people on those days. Especially in labor delivery, I feel like a lot of people think it's just sunshines and roses, and a lot of times it is, but there's times where it's not all happy. And what honor it is that I get to be there as a nurse and be there for that person. They may not remember my name at the end of the day, but they're going to remember the face of that nurse for them on that day of their life. And I think that's just so awesome that I get to look back on my career when I retire many years from now and I get to say I got to make a difference in these people's lives. Whether they remember me or not, it's a huge deal being able to those people. And then lastly, another thing with nursing is there's endless opportunities. So the next slide I'm going to kind of go over with you guys just job opportunities altogether for nursing. There are plenty of opportunities to advance your career, advance your degree, make more money, and the ability to travel. So with of nursing, you can do all kinds of different specialties, right? So I am a nurse, but I'm specialized in labor and delivery. Whereas this other nurse can go specialize in ICU, or this other nurse can go and do cosmetic nursing and administer Botox, or this other nurse can work from home and do insurance. There's a lot of different opportunities within nursing you really can't get with any other career. So I kind of compiled a list here for you guys. It's a lot. So I just wanted to highlight some really cool careers that I didn't know were available to nurses, or really cool careers that are very popular that people are like, oh, I want to do that, or that's something that's really cool. I compiled this list from a bunch of different resources, but it shows you all the different opportunities that you can have as a nurse. So tired of one opportunity, you could be like, hey, I'm going to go do this other thing. That's the beauty of the career. So some main things, some main highlighted careers that I put on here for you guys are nurse practitioner. That's a big, big thing that people want to do. If you don't want to go to med school and become a physician, or go to PA school and become a PA, you can go and become a registered nurse, and then you can become a nurse practitioner, which is really cool. Be a cruise ship nurse. I didn't know that was a thing until now. You can go and live on a cruise ship and travel the world and be a nurse and take care of people on the cruise. I thought that was a really cool job opportunity. You can be a flight nurse on life flights. So that's going to be dealing with your patients, very critical. A lot of times those are patients that are going to be trauma patients. If you love adrenaline, that's going to be a job for you. So these are going to be your individuals that are on the actual helicopters themselves, and they're taking care of these very, very sick patients that need to be transported to higher care, or patients that are coming from car accidents or things like that. I thought that was pretty cool. Another career opportunity for nurses is becoming a nurse anesthetist. So instead of going to school to become an MD, a physician, and then going for several years to become an anesthesiologist, that's a lot of schooling. Whereas a nurse anesthetist, you can be a registered nurse for a couple of years, then go back and get your advanced practice degree as a nurse anesthetist. And you can actually put people to sleep in surgeries like an actual anesthesiologist would, which is really cool. Another big job that you can do as a nurse is a pediatric nurse. So a lot of people like to do that. That's part of my job somewhat. But if you just wanted to deal with kids, you can work in like a pediatric ER, you can work in like a pediatrician office, things like that. You can be aesthetic cosmetic nurse. So if you're like, I don't want to work in a hospital, I don't want to deal with sick people all day, you could literally work Monday through Friday and administer Botox to people all day, which is really cool. A forensic nurse. I had no clue that that was a thing. I won't lie to y'all. I had no clue that was something you can do with a nursing degree, but again, you learn something every day. A forensic nurse would be like a nurse that deals with people after they pass away, or if there's like a murder scene or anything like that. A forensic nurse can help with the actual autopsy itself. You can be a Disney nurse. If you're a Disney obsessed person, you can actually work at Disney's Magical Kingdom. So you can go there and you can deal with people that pass out from heat exhaustion in the park. You can deal with people that fall over and hurt themselves. You can deal with all kinds of things in Disney. So I thought that was cool too. If this is your cup of tea, it is not mine, but you can also be a prison nurse. A prison nurse is going to be someone that works in the actual prison themselves, people who are in prison, and you're dealing with inmates there, dealing with any type of injuries they have, and helping medicate them if they need any medications while they're there in prison. And then lastly, another major highlighted role of nurse is you can also be a travel nurse. These travel nurses travel all over the world for different job opportunities. And a lot of times they're for very short periods of time, but you make a lot of money and you get to travel the world too, which is really cool. So my big thing when I was in high school is understanding why and how you become a nurse. I feel like a lot of times people just talk about, oh, you just become a nurse. And I was always confused, like, well, how do you become a nurse? Like, you don't just become a nurse overnight. So I think the big question, especially for people that are in high school, is what's my next step? What do I do? Where do I go? And how do I pursue this career? And so I wanted to make this really cool diagram for you guys to kind of display the pathway and the different routes you can take to become a nurse. So obviously you're going to need a high school degree. So I hope that all of you guys anticipate to graduate high school and have that degree with you. After that, there are two options that you can do. So first, you can get your Bachelor's of Science in Nursing degree. So that's what I did. I went to a 4-year university and I received that diploma. Or you can go and get your ASN, which is your Associates of Nursing and or your Associates of Science in Nursing, and that's a 2-year degree. And that would be you would go to a community college. So that would be a good route for individuals that don't have the financial support to go to actual big university and get a bachelor's degree. And that's also a good option for people too that don't want to pull out loans or be in debt when they graduate college. So those are two different options for people. I think a lot of people don't realize that you can go and get an associate's in nursing and then you can become a nurse still. You can absolutely do that. So after you get your degree, either your BSN or your ASN, you can become an RN or an LPN. So after you get your associates, you can either become an LPN. If you get your bachelor's of science in nursing, you can become an RN. So LPN's a licensed practical nurse. These are nurses that went and probably got just the associates, and LPNs help with the actual RNs. But the difference between an LPN and an RN is an LPN medications. They cannot give medications, and they also can't do assessments. So if a patient needs a medication, an RN is going to be the one that needs. So like looking at all their clinical findings, only an RN can do that, not an LPN. So those are the main differences. So once you get a license, you can get a license as an LPN or RN. Most people who get an LPN later go back to get their license as an RN. So once you become an RN, you can practice for a couple years, whether that's in the hospital or the other previous career choices that I told you guys about. Or you can go and get an advanced nursing degree. So these would be your doctorate or your master degrees. A lot of people don't just stop at RN. A lot of people get these master's degrees, which is super awesome, or just stay an RN. It's completely up to you. But once you become an RN, there's obviously lots of different avenues that you can take. So you can get your advanced degrees, so you can go back to school. You can become a certified registered nurse anesthetist. Those are the individuals that administer anesthesia with the anesthesiologist. You become a CNM, which is a certified nurse midwife. You can help deliver babies with the OBGYNs. You can get your MSN, which is a Master's of Science in Nursing. with a master's of science in nursing, be a clinical instructor. You can go back to school and be an actual professor at any of the universities. You can also get your doctorate of nurse practice, which is your DNP. That would be like nurse practitioner. And then lastly, you can get also a PhD, which is your doctorate of I can't even pronounce that. I always butcher it. You can get your PhD, and that you can also use back and become a like nurse educator or a professor. So lots of different options. It's super awesome. So lastly, I kind of wanted to make this a short presentation because, like I said, nursing, there's lots of different options. I could talk to you all day about all the different things I do in delivery, or I can talk to you all day about the different things that all these other nurses do. But I wanted to explain to you guys how you become a nurse and general ideas of what a nurse does. I think the big role of a nurse is supporting your patients, right? Like what I was just talking about is you're dealing with people who are on their best days or their worst days of their lives. A lot of everyday people in the hospital, it's hard for them. They don't normally go to the hospital, whereas my job every day is in the hospital. So for them, that's a big adjustment. And trying to cope with that and understand what's happening with their body and maybe not being as independent as they were before, that's a huge, so a big part of being a nurse is supporting your patients emotionally and helping them understand why they're there. So I wanted to give you guys this quote to kind of leave this presentation, then kind of leave the floor open for questions is, this is a quote from somebody anonymous that says, when you are a nurse, you know that every day you will touch a life or life will touch yours. I felt like that quote was super amazing and it really describes what it means to be a nurse. It can be hard sometimes. I won't lie to you, you know, when you work 3 12-hour shifts, sometimes 13 hours, it's exhausting going home and just being like, I just want to go to bed. But knowing that you made a difference in someone's life, that's a huge deal. So I wanted to show you guys this quick video. It's like a 2-minute video that Johnson & Johnson had made for Nurses Appreciation Week. I think it was like in 2018 or 2019, but it explains a little bit about the history of nursing and what it means to be a nurse. So I wanted to show you guys this little clip. Can you guys hear it?
Can't hear it.
1 second. Can you hear it now?
During the Crimean War, more soldiers died from infection than in battle. Until a nurse introduced sanitary practices still in use today. When the scourge of polio hit the world, it was standard practice to strap down and mobilize patients. Until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death. Until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread, so patients were kept quarantined and alone. Until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat. Until a student nurse used what she had on hand, garbage bags and duct tape, to protect herself so she could care for others. And cerebral palsy patients of their ability to speak until a nurse gave them back their voices. And I will always be grateful to her.
Y'all, I thought that video was so cute. I think it really depicts what it's like to be and what it means and what we do on a daily basis. I think a lot of people think that nurses just go to work every day and the doctors tell us what to do. And we're like, yes, sir, no, sir, yes, ma'am, no, ma'am. But there's a lot more to being a nurse. And I think it's just super awesome. And if it's something you're thinking about, um, open up the floor here in a second to questions. But if it's something you're thinking about, I really highly will tell you guys it is a very rewarding career. There's no other career out there like this that has all these opportunities and is very rewarding in the end. And it makes you feel good. It makes you feel good going home and being like, hey, I made a difference in that person's life. They may not remember me, but I sure as heck will remember them and their story. So I thought that video really took 2 minutes to explain the whole career of nursing, which is super awesome. Oh, don't play games.
Thank you so much, Amy. We really appreciate that wonderful presentation. So I'm going to invite you guys to ask questions in the chat, and then I will read them out loud for Amy to answer. So the first question I see is, what would a forensic nurse specifically do at a scene? If you happen to know.
Oh, again, that's not like something I really looked at. I just knew that was a thing today, but I would assume they help kind of with the body and like understanding what happened and like what led up to the murder or the crime scene. But that's something you're more than welcome to look up and see specifically what they do. I don't want to tell you they do something and that's not what they do, but that's kind of my understanding of what they would do at a crime scene.
The next question I see is, what is the difference between a pediatric nurse and a pediatrician?
So, a pediatrician is an actual physician or nurse practitioner. So, a pediatrician would be someone with an advanced degree. So, you really go to medical school and study and go into residency to be a pediatrician. Whereas a pediatric nurse is something completely different. That is going to be someone that's a nurse. So, pediatricians and nurses, they work together as a team, but the pediatrician is going to be the one that's putting in the orders and diagnosing, whereas a nurse is going to be more someone that's doing the assessments, administering medications, noticing when deterioration's happening, and is going to be more at the bedside, emotionally supporting patients.
Did you have certain training after you got your BSN to do labor and delivery?
Yes, I did. Good question. So after I got my RN license by taking my NCLEX and passing my boards, I started at Baptist Medical Center, and so at their hospital they have a res program, which is a year-long program. I'm still technically in it, but I had 18 weeks of orientation with my was on the beginning slides. So I was assigned to one of the older nurses that's more experienced for 18 weeks, and it was very intense, but she taught me literally everything that she knows with labor and delivery. So again, like being an RN or LPN is very just broad, and then you can get additional training to be specialized in certain areas. So that's what I did. I got my license. I applied for a job in labor and delivery, and then I was trained for 18 weeks extensively in just labor and delivery and understanding what I do on a daily basis.
What would you do if you have an unplanned birth?
Like,
Sorry, what would you do if you have an unplanned birth? So I'm assuming that means like at the hospital you're working and there is an unplanned birth.
listen, we are prepared for anything. We've got all the resources we need on the floor, but sometimes it happens. Every now and then we have someone that comes in and they didn't know they were pregnant and they came to the ER and they were having abdominal pain, and all of a sudden, hi, you're pregnant and you're in labor. That happens, but as labor and delivery nurses, we're trained on dealing with emergencies like that. That's considered an emergency. We don't know their background, we don't know the history, we don't know how early in pregnancy are. So on our floor, we have 3 ORs that we have for emergencies and C-sections. So we are prepared for that in a sense, and we always have physicians on the floor to deliver babies whenever they come.
Do you know CNAs that work in labor and delivery or LPNs?
So I actually worked as a CNA on the labor and delivery floor that I work on currently before I became an RN. So it's definitely doable. I'm not sure if all hospitals utilize CNAs on a labor and delivery floor, but my hospital does. And that was a great stepping stone for me to go into my job as an RN. And I really do believe that's what got me a position in a specialty, was working there prior and knowing my manager prior to becoming an RN.
Um, I'll ask a question. Feel free to ask more questions, guys, if you have them. But what can a high school student do to prepare themselves for a career in nursing right now? So maybe they're sophomores or juniors in high school, so they still have a few more years before going to college, but they really think that they're interested in nursing. What can they do to prepare themselves now?
One, obviously make sure that you are in a good academic standing. You have to get a high school diploma to become a nurse. There's no doubt about it. You have to have that just basic education. And if you're not succeeding in your classes, then you can't become a nurse. And you obviously don't need to get straight A's in every classes, because some classes are going to be hard, but give it your best effort and make sure you're putting in the good work to get good academic standing. The second thing I would say is start networking. It's hard to do that in high school, but looking into opportunities at hospitals around you that maybe take volunteers. So maybe you can go and see what a day-to-day life looks like as a nurse or as a CNA, so you can have a better understanding of what they do and how to become one. And third of all, I would say maybe find some good mentors around you. Find some good people that work as nurses like myself, or people that work as CNAs that can help support you and kind of help guide you in regards to, hey, how do I study for this class? How do I apply for this college? Things like that. So I think once you've got that good academic background, then you can start working from there. But if you're not truly putting in the effort in your classes and not getting good results, then that's where it all starts.
Thank you. As a CNA in the labor and delivery unit, what did you do?
Good question. So, because our unit is at LDRP unit, the labor delivery recovery postpartum, I kind of helped more with the postpartum aspect. I would sometimes go to deliveries if they needed more supplies or anything like that. But when I worked as a CNA on the unit I currently work on, I did vitals for all the moms that were postpartum. I did vitals on the babies as well. I also got to help with babies, which is super fun. They don't like it, but we want clean babies to go home. And then I would also stock up all the patients on their different supplies. So if they needed more diapers for babies, I would bring them diapers. If they needed more wipes, I brought them more wipes. If they need more pads, underwear, things for the mom, I would do that. So it was more kind of like a postpartum support, if anything. But if I needed help in a delivery, I would absolutely go and provide those resources or supplies that they needed.
Thank you. What would be the best college to go to get this job?
A job in labor and delivery specifically, or just to become a nurse in general?
Joseph, do you have, it was your question. Labor nurse.
So all the universities and colleges just kind of give you general, like a general basis in nursing, so not necessarily specialized in labor and delivery. So when I went to UNF, I had clinical rotations in all the different specialties. So pediatrics, ICU, ER, OR, delivery, NICU, psych. So it was kind of just like a general education background, which you're going to get at any college. But I will say that if you're looking into being a nurse, really do your research on which colleges have the highest NCLEX pass rates. So the highest board pass rates. That's really going to give you a reflection as to how good the university is, how good their professors are, and how good their clinicals are. I will say UNF is in the top 3 in the state of Florida for a high pass NCLEX rate, behind UCF, and I want to say FSU or UF is in the top 3 as well. But if you're looking into doing nursing, make sure you're going to a university that's accredited and also has a good pass rate, because if they're not giving you the education you need to pass the boards, you're not going to become a nurse. So you need to make sure you're passing your boards and you have a good support system around you.
Thank you. And you could find those numbers that she mentioned online if you just simply, did a Google search. If you could change something you've done while pursuing labor and delivery, what would you recommend?
Ooh, that's a good question. Like, what would I change? I honestly feel like the only thing that I would really change was becoming a CNA sooner, because I became a CNA like right before I graduated, and I really do think that job taught me a lot of what it was like to be a nurse, and like just making myself comfortable with patients and walking to a room and knowing what to look for and how to help a patient in their most vulnerable moments. So I really recommend to anybody. I honestly think it should be a requirement by all the states, my opinion, that every nurse should go on a CNA before they become an RN or LPN, because it teaches you those basic fundamentals of how to change a patient, how to take their vitals properly, different things like that. So I think that's one of the main things I would have changed, is becoming a CNA sooner.
Thank you. What is the difference between a nurse and a physician assistant?
So I'm assuming you're talking about a nurse practitioner. So I'll kind of divulge into that, because the RN versus PA, that's like not equivocal. Like the RN is getting a bachelor's, whereas a PA is getting a master's. So I'll discuss a nurse practitioner, PA. So practitioner is your advanced practicing nurses. So they went back and got a master's or a doctorate degree. A PA is going to be someone that got a generic bachelor's degree in some type of science and then went to PA school. So the main differences between a nurse practitioner and a PA, again, they're very similar, but just some like different things is a nurse practitioner was previously a nurse. So they have a clinical background being in a hospital, whereas a PA, you're not required to go and work in a hospital before you become a PA. So most nurse practitioners have more of a like they have more of a humane approach, I would say, that they are more understanding and know how to talk to you better because they were previously a nurse. Whereas PAs could be someone that got a bachelor's degree in mathematics and then went to PA school. I hope that makes sense. But a nurse practitioner can also have their own independent practice. So they do not have to be practicing under an actual MD themselves. So they don't need anybody to supervise them. Whereas a PA, they have to be associated with an MD, so they can't have their own practice. They have to have a supervising physician. So those are the main differentiating roles. So as a nurse practitioner, you can go and own your own doctor's office, whereas a PA, you need to work with an actual MD to be in a doctor's office.
Thank you. If
Good
you
question.
if you were in the path to become a nurse but change your mind, would it be easy to become a medical doctor?
I would say, yeah. I mean, it's not common for people to go and get a degree in nursing and then switch and become a doctor, because you have a whole degree in nursing and you probably have a license. And that way it's easier for you to become a nurse practitioner as a nurse versus being a nurse and then going and becoming an MD. I think that's a misconception. A lot of people are like, oh, the next step up from a nurse is an MD. Those are two completely different career routes. But I would say no. I mean, most like pre-med students, I'm sure you could probably speak to this, Camelia, but most pre-med students are required to take the same prerequisites as a nursing student. So your biology, your chemistry, your microbiology, your anatomy, those are all kind of just general classes that any medical physician or any medical professional has to take.
Thank you. What was your second career choice? Meaning, if you did not become a labor and delivery nurse, what would you have chosen?
If I didn't choose nursing altogether, I probably would have been a social worker or a teacher. Those are all kind of like, they have similar roles in the aspect of your helping people. So I think those probably would have been my alternative career choices. If I didn't choose labor and delivery as a specialty as a nurse, I probably would have did pediatrics with children.
Thank you. What is one of the hardest parts about your job?
Oh man. I think the hardest part as like a labor and delivery nurse, like people coming in with the intention that they're going to have a child and they don't leave with a child. I think unfortunately that's a really, really hard part of my job. And it's unfortunately very sad to see that. But anywhere you work in medicine, there's going to be pros and cons. I think that's just delivery specifically is you're literally seeing people on the best days of their lives and the worst days of their lives. But again, that's just very intimate, and that's why I love nursing is I get to be there with those people if they're mourning the loss of a child.
Thank you. And then, what is one piece of advice you could give a student starting nursing school?
You resources, know which professors you can reach out to, know what study groups are available to you, know if there's like additional supplemental teaching offered for those classes. I think that's a huge factor in success in nursing school. I think for me, probably the hardest class I ever took was anatomy. I think that's hard for anybody because you have to memorize all these different muscles and bones and all the different things. You're like, I've never seen this word in my whole life, and you're expecting me to remember that, and you're expecting me to remember where that is in the body. So I think a big key factor for me succeeding in anatomy was going to supplemental learning. So going to a teacher's assistant and going after hours after class and getting almost like tutoring so I could succeed. So I think when you're starting nursing school, it is a big adjustment because you're learning all those details of the human body that was not discussed in high school or whatever, or learning different medications and side effects that you've never seen before. So I think knowing your resources and knowing what's offered to you at your college and how you can better study and succeed in those classes.
Thank you. Do you think that for a sensitive person, nursing is a good option for them?
Yes, I absolutely do think that. I think you have to have some somewhat good human like interaction skills and empathy and understanding, because you're dealing again with people who are very vulnerable and who are no longer maybe independent like the way they were. So you're dealing with a lot of emotions in a hospital. You're dealing with people that, are frustrated, are angry, or upset, or sad. So being able to empathize with those people and being like, hey, I understand what you're feeling and I'm sorry this is happening to you. I think that's a big, big characteristic of a nurse is empathy and being sensitive. That I will tell you, I when I was in nursing school, I was taught that don't cry. That was a big thing as they were like, nurses don't cry with their patients. That's very unprofessional. But now that I'm a nurse, I see it from the perspective of the patient that you're going through something really hard and your nurse is just kind of standing there watching you. Um, it's kind of like a slap in the face. It's like, okay, like I'm dealing with this situation and my nurse is just kind of like, okay, I don't have to deal with that. Sorry, you're dealing with that. So there's been plenty of times I will admit that I have cried with patients before that I'm like, hey, I'm so sorry this is happening to you and this is a sad situation and it's okay to be upset about it because nurses are human too. It's okay to express emotions with your patients. So I think that makes a really good nurse is being sensitive and that's a good characteristic to have.
Are there any major benefits of being occupied as a nurse in terms of like travel, holiday, health insurance, those kinds of things?
So many benefits. I say nurses depends on work. If you work in a hospital, most hospitals have it set up where everybody has to work a certain amount of holidays and everybody has to work X, Y, and Z weekends. Or if you work in like a Monday through Friday position as a nurse, you don't have to work weekends. So there's different avenues that you can take. Specifically at my hospital, some perks are I don't have to work every holiday. So I can actually go to holidays with my families. Like this previous year, my major holiday was Thanksgiving. So I got to, or no, it was New Year's Eve and New Year's. So I missed New Year's Eve with my family and seeing the ball drop because I was working. But the previous year, Christmas. So it was nice that this year I got to actually spend Christmas with my family versus last year I didn't. So there's some perks about that. And it's nice too that you have the majority of the week off. You work 3 days and then you have 4 days off. So that's nice. And in regards to like health insurance, you get very good health insurance being a healthcare professional that's employed by the hospital. At my hospital specifically, we get really good dental, vision, all the things. So
Thank you, Amy. Does anybody else have any other questions?
good questions, y'all. And then if you guys think of any questions, sorry to hijack you, Camelia. If y'all have any other questions, I was comfortable with leaving my Instagram and my Facebook as well as my LinkedIn there. So if you were just super shy and didn't want to speak up, totally fine. I've been there. My Instagram, Facebook, and my LinkedIn. So if you want to message me later, you think of things later, those are there as well.
All right, guys. Well, thank you so much for coming. As Amy mentioned, she's really open to answering your questions. She's a great person. I know her personally, so please don't be afraid to reach out to her. And we really appreciate your time today, Amy. Thank you so much for coming and talking to our students.
Yeah, thank you for having me. It was nice talking to you guys.